See Live.
Good evening. Welcome to See Live Spotlight, an initiative by Convex Corporate Events, a company that has always focused on innovation, bringing out something which is really worth and carries meaning, which can bring a difference to the society. Today being the 151st birth anniversary of Mahatma Ji, I would like to quote him, where he has said, "God has given us a limited sphere of action and limited vision." Indeed, a personality who has made an impact not just in the Indian subcontinent, but the world around. A man who really promoted peace and non-violence. And on behalf of Convex Events, we salute this great personality. As Mahatma Ji said, we are with limited vision. And a person who corrects our vision and helps us to see the world much more beautifully is a person who will be spending another 1.5 hours of our journey. I'm so happy and so privileged to sit beside a personality who has corrected many visions, who has had an opinion and her own stand by which she had led her life. And we are honored to bring her and present her to you all. Thank you for being tuned in, and I'm so sure that you'll enjoy the journey. Dr. Revathy, good evening.
Good evening.
And welcome.
Thank you. First of all, I just don't know whether I am deserved to sit in this interview, but I think it is God's wish. So thank God and thank C-Clave and thank Jijo and all the team. And also I thank Dr. Hassan and Dr. Hamad to give me this opportunity to have an interview like this.
Doctor, like it says, every story starts from your childhood. I'm sure, like everybody else, you will be also having some bitter and sweet memories of childhood. Would you like to share some with us?
Sure. But I don't want to call it bitter. I will rather call it as an experience. And sweet memories always we have. My childhood, to start with, I just want to tell that I was born in a Tamil Brahmin family. But unfortunately or fortunately, we were living in a place because of some family circumstances where there was no Brahmins around us. And most of the house around us was huts and also few big houses. Big house in the sense what I told is not the huts. So we were living with all the children who were from the huts. So there was no discrimination in my house or in the society I lived. So I was not brought up as a Tamil Brahmin girl with a discrimination, which has influenced my life a lot.
Doctor, normally when we speak about this, the Brahmin family setup, there is those days, some days back, there was untouchability, there was a social stigma there around, but you said that you have never come across with those kind of things. That's a really encouraging thing. Who has influenced you to do that?
In that, my parents, my mother and father, both has influenced a lot. അങ്ങനെ പറയുകയാണെങ്കിൽ ഞാൻ അമ്മ പറഞ്ഞ ഒരു കാര്യം എൻ്റെ ജീവിതത്തിൽ എന്നെ ഒരുപാട് ഹെൽപ്പ് ചെയ്ത ഒരു കാര്യമുണ്ട്. അതെന്താണെന്ന് വെച്ച് കഴിഞ്ഞാൽ അമ്മ പറഞ്ഞിട്ടുണ്ട്, ഒരു കാക്കയോ പൂച്ചയോ പോലും വെറുക്കരുത്, ആരുടെ ഹെൽപ്പാണ് നിന്റെ അവസാന കാലത്ത് നിനക്ക് വേണ്ടി വരിക എന്നത്. അതിന് മെയിൻ റീസൺ ഫോർ ദാറ്റ് ഇസ് മൈ ഗ്രാൻഡ് വാസ് a proper Brahmin. So he was a person who was too much into untouchability and things like that. So when my mother used to help the people around, he used to have problem with them, with my mother. So what happened, my grandfather fell down when he took bath in the pond and he had hemiplegia. That time these people were the one who carried and brought my grandfather to the house. So my mother always used to tell from childhood that this you should keep in mind always, that you should not hate anybody. Maybe the people who hate will be the one who to help you in the last life. So from childhood I have something. If it is anybody is not in my frequency, what I used to do is I used to be a little away from them, but I never hate them.
Oh, that's great. That's great. Doctor, we just might like to show a message which has come from somebody who's very dear to you. And why not we have a look at the message as we move forward?
Sure.
I am Revathy's Chitti. I don't know what to say about a girl who is perfect in all aspects in 1 minute. However, as desired by you, few words about her. She is a girl who always thinks about the welfare of people around her, whether family member or outsider, without expecting anything from anybody. In my opinion, she has done her duties as a daughter, sister, wife, daughter-in-law, sister-in-law and mother. Hope she will do her duties as a mother-in-law and grandmother in the near future. We are very lucky to get such a gem in our family. Though we are her Chitti and Chittappa, she treats us like her parents and we also treat her as her own daughter. She being a doctor and the only one in her family, for each and every problem we first consult her and then only go for further treatment. A diagnosis comes true 100% in all cases. I have only one complaint about her, that she finds no time to look after herself. Not only for the sake of our family, but for the nation she born and she served, her presence is essential. Hope God will bless her in all aspects. I also want to mention the support her husband Krishnan to her in all aspects. As to get a son-in-law like him is also a blessing to our family. Actually, we think him as a son and not son-in-law. With all prayers.
Doctor, maybe one more. Start it.
A family to say, but like joint family. Everything was discussed and done in a joint way.
All right. And now, when it comes to family as such, Doctor, I'm sure the family concept of being a nuclear family, nowadays it's become even more a nuclear family, where it's just vacations that children visit their grandparents. What do you think is the difference then and now that we see in influencing and shaping of a personality as such?
I think I would go for a joint family rather than a nuclear family. Even though we were living as a nuclear family, I was brought up like a joint family member. As I told you before, everything and anything was consulted with everybody before doing. That is one thing. Then my father used to like his uncle and uncle's children so much, which I recently recognized in a very small function which I organized for my son, which was a religious function. I just had a WhatsApp message with my father's cousin who are in late 80s or in late 70s, but everybody came and blessed. I was so proud of that moment. I think that relation should be there. Now, if I ask my children, who is your cousin's children, they may not even know. So even though we were living as a nuclear family, we were like a joint family. So I think that concept at least should be there. I am not against nuclear family. In this era, നാടോടുമ്പോ നടുവേ ഓടണമെന്നാണ് പറയുക. അപ്പൊ നമ്മൾ ഈ കാലത്ത് ജോയിന്റ് ഫാമിലി വേണമെന്ന് പറയുന്നതിനോട് എനിക്ക് അങ്ങനെ പറയാൻ പറ്റില്ല, ബിക്കോസ് ദാറ്റ് ഈസ് നോട്ട് പോസിബിൾ. അപ്പൊ പക്ഷെ ആ റിലേഷൻഷിപ്പ് നമുക്ക് കീപ്പ് ചെയ്യാൻ പറ്റും. ഇപ്പൊ സോഷ്യൽ മീഡിയം അങ്ങനത്തെ കാര്യങ്ങളൊക്കെ ഉള്ളത് കൊണ്ട് നമുക്ക് ഐ തിങ്ക് വി ക്യാൻ മേക്ക് ഇറ്റ് ലൈക്ക് എ ജോയിന്റ് ഫാമിലി, ബിക്കോസ് ദ അഡ്വാൻറ്റേജ് ഈസ് if the children become close, with them, anything, it's a life. Anything can happen to you at any time. It is not that the next moment is good for you. No, you don't know. So if they are living with everybody or they are close with everybody, somebody or the other will be there to take care of them in calamities.
Wonderful, wonderful thought, Doctor. Doctor, now from a childhood days, let's move to the schooling. You've done your schooling in the village that you came from, or
yes,
you went to the city?
It was actually a municipality. I studied in a government school only. My father was actually lab assistant. In that days, he was only 10th standard, but 10th standard was enough to work as a lab assistant, and he was working in Travancore Rayons company. So we were brought up in that municipality. So I was studying in government girls' high school. First, it was a mixed school, and after 4th standard, we changed to government girls' high school. My school days, I would say, wonderful days. I want to split it as 2 times. First is from 5th to 7th. I had a great friend called Mary Elizabeth Ralph. Okay, she was a daughter of the municipal judge that time. We were great friends. She influenced me a lot in reading habits.
Okay.
Because she used to give me books to read and we used to play together. But there was a difference between me and her. That she used to study well and she used to be the first rank holder. Here again, I just want to come with the concept of Tamil Brahmin culture. In our culture, it was that the girls should not study too much. Okay. They are anyway, they have to get married. Yes. So minimum education you give them. And the boys are given importance. So in my house, always they used to give importance to the studies of my elder brother, who studied in IIT Madras and he's in States now. And younger brother also, he is an advocate in High Court, Ernakulam. So the boys were supposed to study well and the girls simply, you go to school, you go to school. So nobody cared that whether I study or not study. So what happened, every 3 years judges get transferred. Mm-hmm. So Mary's mother, just before leaving, she said, you are with Mary always. She always get very good marks and you don't get. So I think you should come to her level also. Somehow that comment gave me a positive attitude to the study and I decided to study well, or I put a benchmark. Here again, I just want to tell my mother's quoting. My mother always used to tell, you should not deserve or you should not desire to get a first rank, because if you want to get a first rank, you think that all are behind you. So always you can put a mark. You want to get 60%, you want to get 70%, you want to get 90%, that is good. But you don't think that others should be behind you. So I put that as my challenge and I used to keep some marks. So 7th standard only I started studying properly. 7th standard I got a 360. That was a first class mark that time. Then I thought, no, I have to get 400. I didn't get 400 in 8th standard, even though I tried a lot. There I had problem with Sanskrit. So I told my mother, no, I need to change the language because the Sanskrit teacher had some discrimination between the white children and black children. So that affected me a lot. But I don't want to take it as a bitter experience here too. Then what happened, 9th standard, I changed to Malayalam. There I had to study a Malayalam lot, but Bharati teacher helped me a lot. And then I studied Malayalam. Then my mark came to 400. Then I thought, no, I have to get 450 marks. But when I got 450 marks, it was in the 10th standard, Christmas exam. Then I thought, no, I have to get 500. Then I set the level like this, little bit increase. Somehow in 10th standard, I got 522 marks.
Wow, okay. I really like that concept of target setting, by which you set targets. And this is a great message to my audience who are listening, especially the students, when you say that I cannot improve. That's an amazing example that doctor has told us, that you can set your small targets and keep achieving small goals, and thereby you set your standards and raise up. Doctors, salute you for that great advice. And it's often a big confusion for students in this, and I really salute you for that. On that note, I would like to take your attention to your school friend, and I'm sure you'll enjoy the message that she sent for us. Okay.
Hi, Namaskaram. My name is Sauda. I am a civil engineer. I am a government uddiyosthayanu. എൻ്റെ ചൈൽഡ്ഹുഡ് ഫ്രണ്ടിനെ കുറിച്ച് സംസാരിക്കുന്നതിനായിട്ട് എനിക്കൊരു അവസരം തന്നതിൽ എനിക്ക് വളരെ സന്തോഷമുണ്ട്. എൻ്റെ സ്കൂൾ ജീവിതത്തിനെ കുറിച്ച് ആലോചിക്കുമ്പോൾ എൻ്റെ മനസ്സിൽ ആദ്യം ഓടിയെത്തുന്ന ഒരു പേരാണ് രേവതി. ഞാനും രേവതിയും 7ാം ക്ലാസ് മുതൽ പ്രീ ഡിഗ്രി വരെ ഞങ്ങൾ ഒരുമിച്ച് പഠിച്ചിട്ടുണ്ടായിരുന്നു. സ്കൂളിലും കോളേജിലും സ്പെൻഡ് ചെയ്ത ടൈമിനേക്കാളും എൻ്റെ മനസ്സിൽ എന്നും തങ്ങി നിൽക്കുന്നത് ഞാനും രേവതിയും ഒരുമിച്ച് രേവതിയുടെ വീട്ടിൽ സ്പെൻഡ് ചെയ്തിട്ടുള്ള സമയം ഞങ്ങൾ ഫ്രണ്ട്സ് എല്ലാവരും കൂടെ രേവതിയുടെ വീട്ടിൽ കൂടുന്നതെല്ലാം. രേവതിയാണ് എന്നെ ഹാർമോണിയം പഠിപ്പിച്ചത്, അതുപോലെ തന്നെ തമിഴ് ആൽഫബറ്റ്സ് എല്ലാം പഠിപ്പിച്ചത്. Her mother used to prepare a very good filter coffee for us. And even now, I can feel the taste of that coffee. And രേവതിയുടെ വീട് എനിക്ക് എൻ്റെ സ്വന്തം വീട് പോലെ സ്വാതന്ത്ര്യമുള്ളതായിരുന്നു. രേവതിയുടെ ഏറ്റവും പ്രധാന ഒരു ക്വാളിറ്റി ആയിട്ട് എനിക്ക് തോന്നിയിട്ടുള്ളത് ഡെഡിക്കേഷൻ ആൻഡ് ഹാർഡ് വർക്ക്. അതുപോലെ തന്നെ ഷി വാസ് വെരി സോഫ്റ്റ് നേച്ചർ ആൻഡ് വെരി ലവിങ് ആൻഡ് ഹെൽപ്പിംഗ് പേഴ്സൺ. ഇന്നും രേവതി വളരെ സക്സസ്ഫുൾ ആയിട്ടുള്ള ഒരു ഡോക്ടറായിട്ട് വർക്ക് ചെയ്യുന്നതിൽ എനിക്കൊരു അത്ഭുതമില്ല. ബിക്കോസ് ഷി വാസ് ദാറ്റ് മച്ച് ഡെഡിക്കേറ്റഡ് പേഴ്സൺ. രേവതിക്കും രേവതിയുടെ കുടുംബത്തിനും എല്ലാ ഐശ്വര്യങ്ങളും സന്തോഷങ്ങളും ഞാൻ ആശംസിക്കുന്നു. നന്ദി.
താങ്ക് യു സൗദ. സൗദ ആക്ച്വലി അവിടെയാണ് ഒരു കാര്യം പറയാൻ ഞാൻ പറഞ്ഞത്. ചൈൽഡ്ഹുഡ് മുതൽ ഞങ്ങൾക്ക് അങ്ങനെ ഒരു ഡിസ്ക്രിമിനേഷൻ ഇല്ലാത്തതുകൊണ്ടും എൻ്റെ പേരൻസ് അങ്ങനെ എല്ലാവരെയും ഒരേമാതിരി കണ്ടിരുന്നതുകൊണ്ടും എനിക്ക് അങ്ങനെ ഒരു പ്രോബ്ലം ഇല്ലായിരുന്നു. എൻ്റെ എല്ലാ ഫ്രണ്ട്സും എൻ്റെ വീട്ടിൽ വരാറുണ്ടായിരുന്നു.
ഒരു വ്യത്യാസം
കണ്ടിട്ടില്ല. പിന്നെ എന്താ അതിൽ പറയാനുള്ളതെന്ന് വെച്ച് കഴിഞ്ഞാൽ ഞങ്ങളുടെ വീടിൻ്റെ അടുത്തായിരുന്നു ഈ 11th and 12th എല്ലാവർക്കും ട്യൂഷന് പോകുന്നൊരു ഇതുണ്ട്. അപ്പോൾ ഫിസിക്സ്, കെമിസ്ട്രി, മാത്സ് എല്ലാവരുടെയും ട്യൂഷൻ സെന്റേഴ്സ് എൻ്റെ വീടിൻ്റെ അടുത്തടുത്തായിരുന്നു. അപ്പോൾ ഇവരൊക്കെ കുറച്ച് ദൂരെ നിന്ന് വരുന്നവരായിരുന്നു. അപ്പോൾ അവർക്കെല്ലാവർക്കും ഇപ്പോൾ ശനി ഞായറും ആയിരുന്നു ഫുൾ ഡേ ഇങ്ങനെ അന്നൊക്കെ ട്യൂഷൻ. അപ്പം രാവിലെ 8 മുതൽ 10 വരെ ഒരാളുടെ അടുത്ത്, പിന്നെ 10 മുതൽ 12 വരെ, പിന്നെ 2 മുതൽ. അപ്പം എല്ലാവരും ഫുഡൊക്കെ കൊണ്ടുവന്ന് എൻ്റെ വീട്ടിൽ വെക്കും. എന്നിട്ട് എല്ലാവരും ഉച്ചയ്ക്ക് വന്ന് അവിടെ ഇരുന്ന് കഴിച്ച്, അപ്പൊ ആ ഒരു ഇതിൽ ഞങ്ങൾ ആ ഒരു ഒഴുക്കിൽ അങ്ങനെ പോവുമായിരുന്നു. സ്കൂൾ മെമ്മറീസ് വളരെ നല്ലതായിരുന്നു. പിന്നെ യുവജനോത്സവത്തിലൊക്കെ പങ്കെടുക്കും. എന്ന് വെച്ചാൽ ഒരുപാട് ഗ്രേറ്റ് ആയിട്ടൊന്നും അല്ല, പാട്ട്, ഗ്രൂപ്പ് സോങ്സില്, അങ്ങനത്തെ ഓപ്പനപ്പാട്ട്, അങ്ങനത്തെ എല്ലാത്തിലും ഞാൻ പങ്കെടുക്കുമായിരുന്നു.
പ്രൊഫഷണലി പാട്ട് പഠിച്ചിട്ടുണ്ടോ?
പഠിച്ചിട്ടുണ്ട്. ഞാൻ ശാസ്ത്രീയ സംഗീതം പഠിച്ചിട്ടുണ്ട്. അവിടെയും ആക്ച്വലി ആദ്യം എന്നെ ഡാൻസ് പഠിപ്പിക്കാനാണ് വിട്ടത്. കലാമണ്ഡലം സുമതി, ആശാ ശരത്തിന്റെ അമ്മ ഞങ്ങളുടെ വീടിന്റെ അടുത്തായിരുന്നു. അപ്പൊ അവിടെ ആയിരുന്നു ഞാൻ ഡാൻസിന് പോയിക്കൊണ്ടിരുന്നത്. അപ്പൊ ഡാൻസ്, പാട്ട് ഇങ്ങനെ ടീച്ചർ ഇങ്ങനെ പാട്ട് പാടിയിട്ട് ഡാൻസ് കളിക്കണമല്ലോ. അപ്പൊ പാടുമ്പോൾ ഞാൻ കൂടുതൽ പാടും. അപ്പൊ ടീച്ചർ പറഞ്ഞു, ഇവളുടെ ശബ്ദം നല്ല, നീ ഡാൻസ് പഠിക്കുന്നതിലും പാട്ട് പഠിക്കുന്ന മോളെ നല്ലതെന്ന് പറഞ്ഞു. അപ്പൊ അങ്ങനെ ആണ് പാട്ട് പഠിക്കാൻ തുടങ്ങിയത്. പിന്നെ ഒരുപാട് പ്രൊഫഷണൽ ഒന്നും ആയില്ല. എൻ്റെ പാട്ടിനെ കുറിച്ച് ഞാൻ പറയുകയാണെങ്കിൽ എനിക്ക് എപ്പോഴും പാട്ട് ഒരു സന്തോഷം തരുന്ന ഒരു ഇതായിരുന്നു. എപ്പോഴും ഞാൻ തന്നെ ഇരിക്കുമ്പോഴോ അല്ലെങ്കിൽ അമ്പലങ്ങളിൽ പോകുമ്പോൾ, എന്നെ പൊതുവെ ഒരു അമ്പലവാസി എന്നാണ് എല്ലാവരും വിളിക്കാറ്. ഞാൻ സ്കൂൾ ഡേയ്സിലാണെങ്കിലും കോളേജ് ഡേയ്സിലാണെങ്കിലും ആ ഒരു രീതിയായിരുന്നു. അപ്പോൾ അമ്പലത്തിൽ പോകുമ്പം ഞാൻ ഏത് അമ്പലത്തിൽ പോയാലും എനിക്ക് അങ്ങനെ ഒരു ഇൻഹിബിഷനൊന്നുമില്ല. എനിക്ക് അപ്പൊ എന്ത് തോന്നുന്നു ആ പാട്ട് ഞാൻ പാടും. അതിപ്പോ ആര് കേൾക്കുന്നു അല്ലെങ്കിൽ അതിൽ കുറവുണ്ടോ, അതിൽ രാഗം ചിലപ്പോൾ ശരിയായിരിക്കില്ല, വേർഡ്സ് ചിലപ്പോൾ ശരിയായിരിക്കില്ല, പക്ഷെ എനിക്ക് അപ്പോഴും ആ ഭാവമാണ് ഇമ്പോർട്ടന്റ് ആയിട്ട് തോന്നിയിരുന്നത്. എനിക്ക്
പാടുവോ ഡോക്ടർ?
ആ പാടും.
ഇപ്പൊ ഞാനൊന്ന് ചോദിച്ച ഒരു 2 വാക്കൊന്ന് പാടാൻ നോക്കൂ, ഒരു 2 ചരണങ്ങൾ, ഇഷ്ടമുള്ള ഒരു പാട്ട്.
குறையொன்றுமில்லை மறைமூர்த்தி கண்ணா, குறையொன்றுமில்லை கண்ணா, குறையொன்றுமில்லை கோவிந்தா, குறையொன்றுமில்லை மறைமூர்த்தி கண்ணா, குறையொன்றுமில்லை கண்ணா, குறையொன்றுமில்லை கோவிந்தா. கண்ணுக்கு தெரியாமல் நிற்கின்றாய் கண்ணா, கண்ணுக்கு தெரியாமல் நின்றாலும் எனக்கு குறையொன்றுமில்லை மறைமூர்த்தி கண்ணா. வேண்டியதை தந்திட வேங்கிடேசனிங்கிருக்க, வேண்டியது வேறில்லை மறைமூர்த்தி கண்ணா, மணிவண்ணா மலையப்பா ഗോവിന്ദ ഗോവിന്ദ.
ലയിച്ചിരിക്കുകയായിരുന്നു ഡോക്ടറെ. നന്നായിട്ട് ഒരു നല്ലൊരു പാട്ട് കേൾക്കാൻ കിട്ടിയെന്ന് ഫ്രം എ പേഴ്സൺ ഹൂസ് ലുക്കിംഗ് അറ്റ് ഐസ്. And in your song, you also said about something about eyes also. I see that.
No, that is, the song just mean that even if I cannot see you, you are the one who is guiding me in my life. And I don't have anything which is less.
All right, okay.
I am blessed with everything. So kurayondrumille means I don't have any kurai.
Anything less.
Anything less. Yeah. I am fully blessed.
Yeah.
Because of you.
Wonderful. Now I would like to just take your attention and draw you towards, many people talk about human and God relationships, you know. How do you value this importance? Being a professional in the society, being a doctor, how do you value a human to God relationship?
I think it is a one-to-one relationship. See, I don't have any problem with any religion or any gods. Maybe because I was strongly believing in one word of Bhagavad Gita, where God says, or the Krishna says that I come to everybody in the way they pray. So every person has their own rights to pray in their own way they pray, and it should be respected. And what I feel is, if you are egoless and call God, definitely He will answer.
Wonderful.
The problem is, when we call God, we are always with ego. We want something from Him. It is not that. നമ്മുടെ ഒരു നിസ്സഹായാവസ്ഥയിൽ നമ്മൾ ദൈവത്തിനെ വിളിച്ചാൽ ആ വിളി ദൈവം കേട്ടിരിക്കും. അതിൽ ഞാൻ വിശ്വസിക്കുന്നു. എനിക്ക് യാതൊരു ഇതുമില്ല. ഞാൻ ഓരോ പ്രൊസീജിയർ ഹോസ്പിറ്റലിൽ ചെയ്യുമ്പോഴും I used to tell the patient, you tell Bismillah Rahman Rahim. Okay. Many patients used to ask me, are you Muslim?
Oh.
Okay. I used to go to church. I read Bible daily.
All right.
So for me, all gods are same. The way you pray is different. All God concept is, God is, see, there is somebody who is above you. That we should always think. Exactly. It will help in many things. Bhayam, Bhakti, Bahumanam. ആ മൂന്ന് കാര്യവും നമുക്ക് ജീവിതത്തിൽ വേണം. അത് നമ്മൾ എല്ലാ കാര്യത്തിലും നമ്മൾ അത് അപ്ലൈ ചെയ്യുകയാണെങ്കിൽ എനിക്ക് തോന്നുന്നു നമുക്ക് മുന്നോട്ട് വരാൻ പറ്റും.
Wonderful. Wonderful thought. Doctor, let me just now move towards your professional life. When did you feel that you needed to be a doctor? Is it from you or is it an influence from someone? I just wanted to understand how the whole concept of you becoming a doctor, you know.
See, that is what you first asked about the bhakti.
Yes.
If I am a devotee now, devotee of God, as I told you, I feel everybody is same. All gods are same. It is because of my mom. Because her bhakti was, you know, without any conditions. Unconditional love or unconditional way of devotion it was. And if I am an ophthalmologist now, it is only because of my father.
Okay.
As I told you in the beginning that my father was not caring about my studies until 10th standard. Okay. He don't even know that I am getting this much mark. Just signing the progress card. But boys' progress card, if there is any red line, they used to get beating. I used to get lot of beating because my father, when beats my brothers, I used to go in between them and tell, Appa, please don't do this, please don't do this, like that. You know, so the thing is, they never cared about the education of the girl child. So again, that time, it was not this time, I'm telling. There the valuation, after that the tabulation will be in Trivandrum. So a lot of children in my age was in my father's office. So one of the child's father sent the number with the teacher to get her mark. That time he also told that find out the first, second and third of the our school. So luckily that man brought and it was my name for the second.
Oh, great.
So my father, I still remember, he had a second duty because second shift comes from 2 o'clock to 10 o'clock. So he will come home by 11 o'clock. So I was sleeping. I was acting as if I was sleeping because I know tomorrow the result or the marks will come. So I heard him telling to my mother, അവൾക്ക് സ്കൂളിലെ രണ്ടാമത്തെ റാങ്ക് എടുക്കാം, അപ്പൊ അവളെ ഡോക്ടർ ആക്കണം. So that is the time he realized that I should become a doctor.
Okay.
So then he wanted me to become a doctor, but again I used to like maths a lot.
Okay.
So I told him no way. So my mother was a person who believed in this horoscope a lot.
Yeah.
So she took the horoscope to one of the people there and went and asked, what shall I do for my child? Then he told she will become good in maths as well as in Vaidyashastrathilum Ganithasastrathilum Nibunayavum. So there was no choice. Then my mother told, what shall I do? Your father is adamant that he will send you to second group. I said, okay, I will take additional maths.
Oh, wow. Okay.
Then I took additional maths. That time that option was there and I studied mathematics. But my brother was in IIT. So he told that the engineering is not that
Easy.
good, easy for females in the lab and things like that. He knows because he went. So I was forced to write the medical entrance and I became a doctor.
Wonderful.
That is what, here I just want to tell one thing, that എൻ്റെ ജീവിതത്തിൽ നടന്ന പല സംഭവങ്ങളും നിമിത്തങ്ങളും നിയോഗങ്ങളും.
Okay.
It is not that I wish to become and I became, or I had a childhood dream and I become, no.
So it was more of a destiny that shaped your...
Yeah, it's all God's grace. That is what I said.
Wonderful. And how was your education in college?
College, for pre-degree, I studied in St. Xavier's College.
Okay.
It was very busy. As I told, I took additional maths, and everybody is entrance oriented. So that time we were in municipality, as I told, there was no entrance coaching class. So the people who were in Alva or Ernakulam were privileged to get the universal and hours coaching class. But I studied all the books which my brother bought for IIT for physics and chemistry, and I had an Arun's Gate to study for.
Oh, so you remember still those guys?
For biology, and it's only God's grace I got through the entrance examination.
Let me just take a break here and bring a teacher of yours who has taught you and of course has influenced you also.
Sure.
Why don't we take a look at the...
I am Dr. Vijay Raghavan, retired professor of ophthalmology, Coimbatore Medical College, Tamil Nadu, India. Dr. Revathy did her post-graduation in our unit at Madras Medical College during 1993 and 96. A highly dependable student, very sincere. She used to do her work with utmost perfection. In fact, she stood first in the university examinations in that year. Definitely, I'm sure she will be an asset to any institute. In fact, we had the luck of having her as our student. Best wishes for her. Thank you very much.
Thank you. Thank you to bring sir in this show, because I have a lot of personal relationship with sir. The thing I just want to tell is MBBS was easy for me, I will tell. As I told you, I got through the entrance, and I don't think, I do want to tell something about MBBS, but I will tell later about it. But PG was really difficult. Not in the sense that I didn't get, I got luckily in the first All India entrance, we couldn't write. And the second entrance, I wrote. And I got a reasonably good rank. But my aim again here was to get for general medicine.
Okay.
My passion was general medicine. For that, Dr. Shenai, R.K. Shenai, who was our medicine professor in undergraduate days, influenced a lot. So I did senior house agency just because that time entrance, or first All India entrance, we couldn't write because we finished because of all these strikes in Kerala, which I again want to tell. They delayed our MBBS course. So I had to write the second entrance. So I don't want to waste the time. That time we did senior house agency in Collegiate Medical College. Until that year, it was like that if you have a senior house agency, you have to do only 2 years PG. So I thought that my 3 years PG will come in that way, and I wanted to do general medicine. Here, I got for general medicine, my rank was 421 or something like that, in Arunachal Pradesh, in that side. So my father don't want to send me there. My second choice was ophthalmology, which I got in Madras Medical College. Here again, we saw Chitti, no?
Yeah,
Chitti's husband, my Chittappa, is like my father only. He told my father that, no, let her go for ophthalmology, because if she takes general medicine, maybe she will not have a good family life. Even if she works until 8 o'clock, there is no emergency for the eye. So she will have to have a good family life. So you better send her for ophthalmology.
Okay.
I want to take little time here in
please.
explaining one situation. That year, the Tamil Nadu entrance was cancelled just because of some corruption reason. So only 2 students was coming to MS for ophthalmology. One was from North India, Harish, and second was me.
Okay.
The thing is, until that year, anybody who comes for MS has completed a DO of, that is Diploma of Ophthalmology in 2 years, and then join for MS, because that was the rule until that year.
Okay.
But we were fresh candidates who don't know anything about ophthalmology, just studied ophthalmology for 6 months in the undergraduate days, and then we were forced to take ophthalmology, MS.
Okay.
So they were expecting high from us where we don't know anything. Harish couldn't stand that pressure, so he said, no, I will write next year entrance and I am going from here. He left. So I was the only student, MS student of that year there. They put me in a unit where I had lot of problems.
Okay.
And that was maybe it was my fate, or I don't know. I had really problems in the first year. I used to cry a lot. I would just sit and cry because there is no work for me. I am just sitting there without doing anything. There was Dr. Rajiv. He was the final year student that time. He used to see me crying always. So he told Dr. Vijayaraghavan, go and ask her what is her problem. Then I told, see, like this, I am not. Then he was the one who interfered and put me for rotation in different units where I started getting exposed to the things. Yeah. And then with God's grace, I will tell, I was transferred to first unit where I got a lot of good exposure and experience and things like that. So during that time when I was so much frustrated, I even asked my friend Sunil, who was in Ahmedabad, to exchange. You come here and I'll go there. Then what he wrote to me is, you be in the place where you are. Here we are having much more discrimination. At least you can run back to Kerala. Here we cannot do that also. So, these are the struggles in PG time, which you have to have.
Wonderful.
So always my father used to say, Konde, you got your MBBS very lightly, but PG you struggled and got, so you have to work.
Okay. So that was a condition laid down to you by your father that you should work all your life and
because
give your time. Doctor, at this time, but just we need to take your attention and move to a college mate of yours. She was so happy that when we contacted her, why don't you send a message? And she sent a wonderful message, and why don't we just have a look?
Hi Revathy, what should I tell about you? You are my sister, not a friend, Revathy. Even after these 35 years we're together, whenever I'm a little low, I'll definitely get a phone call or a message from you asking, hi Bindu, how are you? Those things I wonder, what is this? Is it a telepathy? Even though we are miles and miles away physically, that bondage is there. Not only now, even in my previous toughest days, you were with me, holding my hands tightly, helping me to pass on those days. Even though I was in flood of tears, you were always hugging me tightly. I can never forget those days, Revathy. You were with me those days. You are a sister to my husband also, a bubbly sister. My parents also always keep you close to their heart. Let God Almighty give all the health and happiness to you, Revathy. And be with your Krishnan and children forever. Love you, Revathy. Love you.
What an emotional message sent by a close friend.
Yeah, we are very close. Bindu and Shibu, both of them were my classmates in MBBS days. So I am very close to them. And also I am one of the key person in their marriage. So she is like more than a sister to me. And also I have a lot of close colleagues in my roommate, Mini Menon, Srija, Padmini, all of them. MBBS was a bubbly days.
Wonderful days.
One few things which I want to share is about my sound, where I was I was thin that days. Even in MS days, I used to get only you cannot see her, but you can hear her sound. That was a comment. My sound was always a thing
which they commented on.
Which commented.
Wonderful.
And another thing, funny thing which I want to share in MBBS is, in the beginning we have ragging and things like that. We were put in a hostel which was opposite to the men's hostel. So any time when the current goes, only my name was Revathy Pattatanam, Revathy Kirupavakutti. It was, the boys used to
shout
from there. But later my boys colleagues told me that they never told anything bad about you. So that is, at least,
kind of
but MBBS was wonderful days, all, it was more like, there is many things to study, there is many problems coming, but we were like a family going together, and there also there was temple very near to our hostel.
Okay.
I used to go to temple every day, so there I got another name also. My name was Ambalavasi.
Okay. Yeah, you did say that before. Doctor, coming into your professional life, I've been given to understand that you've been here for over 2 decades.
Yes.
23 years, the same Sthavanathil.
Yeah, same Sthavanathil.
And you have seen the rise of a child and becoming a doctor, and now heading the organization.
He is our chairman now.
Chairman, yeah. And I spent some time with Dr. Hamid, and I want to tell you, all those people who are listening to us here, a person who's been so humble, who's so very well-mannered personality, who's educated in the West, in the UK specifically, but to come out and spend time with me and to make me understand. Dr. Hamid is a person who's so humble. When I asked him, Doctor, what has been that influence that Dr. Revathy has played in your life? And he came out with a very pleasant smile and said, the thing which I've learned from Dr. Revathy is humility. The way that she comes across and talks to people, which we have been experiencing right now as throughout these interviews, of sharing those moments of life, which are so wonderful, which we can relate to. Dr. Hamid has sent a message, Dr. Revathy, for you specifically. And why don't we listen to that message?
Hi, I'm Dr. Hamid Al-Arayat, consultant eye surgeon at the Al-Arayat Eye Center, specialized in cataract and retina surgery. I'd like to speak to you today about Dr. Revathy Krishnan, who's been with us for more than 22 years. If I can describe her in a few words, I would say she's a true human being, coupled with experience of more than 22 years, up-to-date surgical skills, knowledgeable, eagerness to learn and teach, respect to patients and staff. We have been extremely privileged to have her here. I personally have learned a lot from her over the years, both in surgical skills, knowledge, and life skills. The community and the Kingdom of Bahrain is extremely proud and privileged to have her here. And I would like to send my appreciation and say thank you, Dr. Revathy, for all the years of service.
Thanks a lot.
What a great message.
Yeah.
A kind of you can say a digital certificate being and shower of praises. Amazing, amazing. How was your relationship with your bosses?
As I told you before, I always respect them. Okay, age is not the thing which prevent. I feel that we should respect every human. So in that way, I even respect Dr. Hamid as my present chairman. And Dr. Hassan, I don't have any words to tell. Dr. Hamid is fully energetic, enthusiastic, and he gives values to human, and also he is very keen in bringing all the new investigative modalities to the clinic, and he wants the eye clinic to be the best one in this island. For that he is trying his best, and he is very good retinal surgeon also, and he has got good training from England. And about Dr. Hassan, if I say, he is a person whom I have seen as a workaholic man, even in this age.
Okay.
He loves work. He loves ophthalmology. He is the one who pushed us to do research. If I have presented many papers, and even for AAO and the World Ophthalmology Conference, everything we have sent paper, and he will go and present, we will make everything, and even I am one of the author in that. But it is only because of his motivation.
Okay.
He tells, no, this year we have to do like this, you have to prepare this much So he gives, another thing is he also buy all the new investigative things in the clinic, and he will tell, okay, this is the catalog of this machine. Okay, you can learn about it and start working. Like that. And always classes, every Monday, it is must for him to have academic reviews. So in there, he motivates all of us, all the staff. If they are well knowledge, it is only because of Dr. Hassan.
Wonderful.
And he is very humble, egoless, very wonderful to have a boss like him.
Yeah, I am yet to meet Dr. Hassan, but Dr. Hassan has sent a wonderful message, and we've kept it as a kind of a surprise package for you to have a look, and I'm sure you'd enjoy the message which Dr. Hassan has for us.
I'm Dr. Hassan Al-Araid, head of the Al-Araid Eye Center. It is my pleasure joining today in the expression of my happy opinion about Dr. Krishnan. We call her by her first name, Dr. Revathy, who joined this establishment since 1999. And we are, in fact, since she arrived in Bahrain, we were lucky to have her working with us, and only with us all these years, after she got her high degree in the field of ophthalmology, medical and surgical eye care. Dr. Revathy is a great sister of whole team working in the department, doctors, nurses, optometrists, and the rest of the staff. And she was keeping we keep very high regards for her and respect, not only because of her sincere humanity, knowledgeable character, but because she is very dedicated, punctual, and keen to progress her academics abilities, as she is very much involved in research, publishing papers, and attending conferences, and established and published a few papers, in fact. Attended conferences, local and international. That's another great way of acquiring knowledge and updating yourself. She's a great teacher to her surroundings. In fact, to her peers, to the optometrists, to the doctors, and she will not hesitate at any time to take any member of her colleagues to explain, to interact, and to establish a new knowledge and experience in various fields. That is something very great for her. So she's not only as a teacher, she is a mentor and very highly, enthusiastic to learn, update herself, and pass all this knowledge to her patients. Her patients insisting, and many of them insisting, that they will have their appointment with Dr. Revathy, Dr. Krishnan. And they are happy because, in fact, all our staff are happy to work with her. So she, in fact, created that kind of a very relaxed, happy environment of work environment. And for the patients, the most important, she's giving her utmost care because of her knowledge, abilities, and in fact, updating her knowledge. Thank you very much indeed.
Again, I want to say whether I deserve these things, I don't know.
But coming from a boss, and after 23 years, as you said.
Yeah, in 1998 April I joined.
Okay.
Actually, not 99.
But this coming from a senior, person who's very well respected in the island.
Yeah.
And talking about Al-Araid Eye Center as such, how do you rate this in terms of your experience of visiting internationally, so many places around? And
I think it is for our eye center, it's a comprehensive eye center where you can get all the eye care services. That is from the basic level to all the super specialty level. We have all the services in our institute.
even surgeries and...
In surgeries also. We have visiting surgeons who can who come here to do the orbit surgeries, the squint surgeries and all. But we have in our place itself all the minor and the major surgeries like cataract, refractive corrective surgery. It is one of the major centers for the refractive corrective surgeries in this island.
All right.
And also retinal surgeries and retinal laser, medical and surgical retina. All services, all comprehensive eye services and all super specialty services are available with us, and all new technologies. I told you before also, Dr. Hassan and Dr. Hamad, both of them are very fond of all the new technologies, and they immediately get it, and we get exposed to it.
Beautiful. And when I was preparing for this interview, you told me one special thing about these, Dr. Hassan specifically, that he's always encouraged you to go out and do things. And that's something which is really so inspiring,
He was the one who pushed me to go and present papers. In fact, I got a Best Paper Award in All Indian conference in Jaipur conference. I don't remember the year. If I have got anything, it is only because of him.
Okay.
Because he always say, no, the conference is coming, you prepare the paper, you present the paper. Everything, he will be behind, somebody who is always there to push,
Amazing. Likewise, doctor, I was just thinking about to get in touch with a colleague of yours. And this colleague of yours is right now not in Bahrain, is back home in India. And I know
Dr. Vinod.
I know you could just catch that before giving the cues. So we have a message from Dr. Vinod specifically for you. Why don't we just
He
take
was
a
a wonderful friend of mine. I don't have words to tell about him. He's really, really wonderful human. I don't have anything else to tell.
So why don't we just take a look and have a look at this message of
Greetings to all from India. In 2014, after a long gap, I came back to Bahrain. And three things, in my mind, she was a chosen one. I say that because there are a few times I heard about her. While I presentation, I noticed something, that the words I chose, classic, confident, companion, colleague, commitment, chosen, all these began with the letter C. And that helped me form a name for her. She is someone who sees through her heart. All my gratitude to you, Dr. Revathy, wishing you all the best. Regards to presentation, I noticed something, that the words I chose, classic, confident, companion, colleague, commitment, chosen, all these began with the letter C. And that helped me form a name for her. She is someone who sees through her heart. All my gratitude to you, Dr. Revathy, wishing you all the best. Regards to Kanan, Sharda and Krishnan. May your family be blessed forever, and wishing you all the best.
Vinod, a very close friend.
Very close friend.
Very close colleague.
Close colleague. I won't call him a colleague. Somebody like a family.
Wonderful. Such a lovely message coming from a colleague, and that too, who's left the island and gone.
It's
but really worth cherishing.
We keep in touch every. I think at least weekly once we speak.
Oh wow, that's great. That's great. That's a lesson also to all of us who are listening to us, that we need to be in touch with our colleagues because they are our extended family. And that's which I would take as a learning from this point of view. Doctor, I was just moving on to where we live in Middle East, with your professional experience of over 2 decades, especially in Middle East, what are the eye diseases that we come across? The common ones.
Common ones, I will tell that allergy is the most common, which I come across in Bahrain. About 50% of the population, I think, will have allergy. I don't know why it's so common here. Maybe because of the seasonal change. Whenever there is a change from in the spring season or the autumn season, during that time, you can see a lot of allergic conjunctivitis. The next who is viral conjunctivitis. It is very common, and every season it will come, but when the climate change from one to other, it's very, very common.
Okay.
We are in a place, and our clinic is just iceberg, okay? There itself, we used to get 5 to 6 patients of viral conjunctivitis. When the season change means how much will be the oleum.
Oh, yeah.
So this is the most common condition we see. Then also lot of, I don't know, maybe the lifestyle is giving the problem. Lot of diseases related to the lifestyle like diabetic retinopathy, hypertensive problems, and glaucoma is another condition which is very much common here in this.
Just if you could break down, glaucoma is related to your lifestyle diseases? Or?
No.
Okay.
Glaucoma, I think maybe it is more here because of the consanguinity.
Okay.
Because here few diseases which are more common than in India. Of course, I have seen keratoconus, a condition which is again related to the consanguinity as well as the environment. The allergy can cause the keratoconus. Very rarely when I was in India, back in India. But here you can see lot of cases like that. So I think environment plus the consanguinity is the reason for glaucoma and such diseases like keratoconus, glaucoma and all.
And Dr.
Then all other problems. The refractive error is very common. But we cannot call it is an island problem. It is a universal problem.
Yeah. But now, Doctor, now we move on to this technology that we've exposed to. We are exposed to a lot of technology, especially in this pandemic time. We are exposed to higher time being spent in front of a screen. Let it be a small screen of a mobile to a laptop, or to even to a television media as such, or even social media that we connect to find out. So this is causing a lot of strain. I personally have experienced a lot of eye strain. What is your advice to these people? How do we rest?
See, here the 20-20-20 rule comes, okay? But 20-20-20 rule is every 20 minutes, you take a 20-second break to see something far 20 feet, okay? But what I would say is, it is not only the eyes is getting strained, your back, your shoulders.
Okay.
So what I would advise is every 20 minutes, get up, stretch yourself, go to balcony or some windows, look far, relax, breathe and come
back. Okay.
Even I feel that if you can come out and breathe the fresh air, we are always inside this AC, which is causing lot of dryness in the eye. So AC itself will cause lot of problem for the eye.
Okay.
So what I feel is if you can move out a bit, it is not practical to get out every 20 minutes, but at least in half an hour one time, if you stretch yourself, look far for a little time and then come back and do your duty, it will be good for your eyes. Not only for the eyes, but also for the body, the circulation, everything.
Oh, wonderful advice, Doctor. Especially the 20-20-20 season of T20. All those people who are listening to me, if you are fans of T20.
Cricket fans, they can remember very easily and connect also very easily.
Exactly. So the T20 season, it takes us to a thought that 20-20-20 rule should be followed. So your eyes can be much relaxed and much more healthier.
And also they say that whenever you enter something, the problem with the people in the computer or the smartphone or whatever it is, they don't blink. See, when you focus on something, the blinking rate naturally comes down. Normal blinking rate, if it is 15 times per minute, it comes down a lot to 3 or 4 times. That causes lot of dryness. The tear gets evaporated very fast, especially with the AC. So you can make it a point that every enter you blink.
That's a nice advice.
That is an advice, but it is not practical. I don't know. Advice. See, always, there is a lot of difference between preaching and practicing. Okay, preaching is very easy. Anybody can do that, but practicing is really, really difficult. So I believe that what you preach, you should be able to practice. Here again, I want to quote Gandhiji, where he has already told that if you can do something, I remember still a story which in his Satyanveshana Kadagal he has written. One man came and told him how to stop eating sweets. Then he told, no, come tomorrow. Then that man asked, why you took so much time? He said, I have to practice myself stopping laddu eating. It's so easy to preach, but practicing
is very tough.
So every ender, who will remember to blink?
Correct.
You will not, your thought will be too much involved, you know,
Into
whether
that,
you are working or whether you are a student.
Right.
You won't.
So blinking is also important. That's right. Doctor, at the same time, there has been a lot of rise in smoking also, you know. At the same time, the curve has always gone down and up. But is smoking and eye problems related?
Yes, you know, smoking usually causes some problem in the blood vessels. Okay. So the blood vessels of the eye also can be affected. And the second thing which is very important for us, if we are seeing, why we are seeing? We are seeing because our nerves are intact.
Right.
I always tell the patients that if you connect the eye to something like a light, you know, the eye is like a light or a bulb. Okay. The nerves are like wires and switch is like brain. If the nerves are not working or the wire is not working, even if the bulb is good, it will not work.
Not blow.
So the smoking can cause problems with the nerves. It can affect the nerves. So I think it is not that good. Okay, once in a while it's okay maybe, but not an addiction.
Yeah, that's great.
Here I just want to quote another thing. Adhigamayal amrudam visham. So I think everything
In
it
excess,
applies. Whether it is good or bad, whether it is too much, it is not good.
Anything in excess will
Anything in excess. Whether it is money, whether it is food, whether it is love, whether it is everything in excess, it is not good.
It becomes a poison.
Yeah.
Wonderful advice, doctor. Doctor, I have seen many people say that, you know, if you are having itchy eyes, you can put some remedies by home remedies. So many home remedies are, you know, the net is filled with home remedies. If you go and, how is what's your advice for that, doctor?
No, the thing here is, you know, now after Google came, or everything is in your fingertip. So anything immediately you go and Google, and whatever remedy or whatever things they say, you go for it. I am not for it. I would say that I am not against home remedies. Okay, many things like, I don't say that every small thing you should go to the doctor. No, you can have something in the house, but it should be hygienic. That is the first thing. Whatever you do should be hygienic. And don't do things which is, you know, like I had one patient a few years ago. She came without able to see anything. I asked her, what happened? What happened? She said, you know, I had salt water, concentrated salt water. I will put that in the ear for some ear problem comes. I put it in that in the eye. What it did dry the cornea, and the cornea became so edematous, the stromal edema. She cannot see anything. She was in such a bad pain. And then it took maybe 2 weeks for her to recover. So such things, no, you will think that, oh, salt water is good. It will kill all the germs.
Correct.
No, you know, she had some mild irritation, so she thought it is conjunctivitis or something. Salt can kill it. You know, salt gargle is good for the throat. The same thing. So like that you should not do. But you can have, you know, like if small eye stye comes. In the olden days, people used to say that you apply warm compress, you can do that. There is no harm in that, because warm compress is one of the best things. You get some allergy going to the pool somewhere, your eyes are very red and itchy, wash with cold water, apply cold compress. Maybe your body will accept it and it will become okay. So for everything and anything, I don't think you should go to the doctor. Small children, when they get conjunctivitis, for example, a 10-day-old baby. Breast milk is good. There is no problem in that breast. Because why breast milk is good? Because breast milk has a lot of antigen. So it can, you know, it is Here I just want to tell all the viewers one thing is, you know, immunity is a thing which develop in children when they are a child. Nowadays, all the children are overprotected. They are not exposed to anything. If you don't get exposed to thing, you have to get exposed to the antigen to develop antibody in your body. So the antibody developing time is only up to the age of 8 or 10. After that, it's very difficult. Okay, when you get a disease, you may get. But the natural antibody production or the bone marrow has to be healthy. Nowadays, the children are really away from that. They are so much protected not to go out, not to play in the sand, not to do anything. So the immunity level in the children as such, or the community as such, is coming down, which is not very healthy.
Doctor, when you said that, my thoughts have raised down to what age should a child get the eye tested first? or evaluate it first, even if it's not for any other reason?
Here I just want to tell few things. Now the AAO guidelines for the screen time, because that is what they say is up to 2 years, children should not see screen. We are doing that.
Any screen?
Any screen.
Oh.
So, see, the children, when the child is born, immediately, if the child want to take food or the child want to be quiet, you are giving phone or you are on the TV.
Yes.
So, that guidelines is not practical or this thing. From 2 to 6 years, they are telling 1 hour. And after 6 years, 2 hours. Whether it is followed? No. Now for an LKG student, online class is 5 hours.
Yes.
Where the child is permitted to see the screen only 1 hour.
Correct.
So that is the thing. Then normal child examination, if you, the first thing what I would like to tell all the mothers is that a child will fixate by 1 month. So if any child born is not looking at your face in 1 to 3 months, then as early as that time, you should bring the child to the doctor.
Because fixate means doctor?
Fixate means when you give milk to the child or something, the baby will look at you and smile.
So that
is the first sign, A mother can recognize very easily that. If the child, when you are giving anything, is wandering like this, like this, that means he is not fixating. He is not able to perceive anything. So that is the first thing I will tell.
To notice.
First to notice any mother. After that, if normal child, a child will be seeing, if not seeing, we will notice it because the blind look will come to the child. Normal routine child examination, if you don't feel anything abnormal with the child, should start at the age of 2 or 3 years first, before school. That is the first thing. Why I insist on that is because of the screens. Because of the screens, lot of children are becoming myopes now. Why they are getting myopia is because the sclera is a collagen tissue and it is elastic. So the growth hormone has a tendency to make more elastic. So when they do more near works, the muscle will pull it. So that causes an elongation of the eyeball and myopia. So because of that, I would say that before school, every child should be at least screened.
Evaluated first.
First for the vision.
Doctor, we are unfortunately going through pandemic. I myself wear a glass and I use the mask. But when I am I try maximum not to use the mask. The reason is because of the flooding of the eyes. The foggy things. How can I avoid that?
You have to put some tape in the nose where we surgeon always feel that, when we put the mask, if we are not wearing it properly or if it is not closed here completely, it will fog the lens or the microscope, we do the surgery. So when you put, and it is very good for pandemic, why I'm telling is, if you don't cover it properly here, there is always a chance that you are inhaling that. So that is to stop the fogging. But one thing I noticed in this pandemic also is, because of this fogging of the glass problem, more people are coming for refractive surgery because they know the difficulty of wearing glasses with a mask.
Correct.
With the mask, the people really have problem. But I think this pandemic is temporary. We should not give too much importance to it. It is something we have to live with it.
I like that positivity which you brought forward in this. But many people are saying that the pink eyes, I've been reading about this. Pink eyes relates to corona and COVID-19. Is there any correlation between that?
I don't think the conjunctivitis can be caused by coronavirus. Actually, the first patient I had, one baby came to me telling that 3 days conjunctivitis. I saw the baby and the baby's father was also with that baby. And I thought it was full follicles and things like that. So it was more like an allergy in both eyes. So I gave her something antibiotic steroid combination we call. Next day, the call came from ministry telling that baby and father is positive for corona. So you have to go and get tested. So whether that was a corona related problem or not, I don't know. But when I call the baby, because corona is a new virus, we don't know whether the steroid can be given for such children. So I called the parents and asked them how it is. They said baby is much better with the eyes now. So whether it is Corona related or not, we don't know. But coronavirus can cause conjunctivitis. As like any other virus which causes follicular conjunctivitis, coronavirus also can cause conjunctivitis. Even if it doesn't cause conjunctivitis, the secretions of the eye can be infected.
Okay, it can infect the person. Oh,
that is that we should know.
Yeah.
The secretions of the eye, the nose, the mouth can be infective.
Okay.
It all can shed the coronavirus.
All right.
And it is many research, even the Chinese, because there it originated. We don't know whether it came from them or
anywhere.
We will leave it to God.
Yeah.
He will know, and He will find a solution for it.
Yeah. Wonderful.
So there they have done a research and they have found out that even after like you are cured from corona, you say after 14 days, even up to 37 days, you can find the coronavirus in the secretions of the people who are infected.
Oh, okay.
So it is not that,
it's completely protected. Doctor, now the other thing which I have noted is many people wear contact lenses. Yeah, and my doubt has always been that I can change my the color of my eyeball from what is presently to maybe a cat eye. So these colored lenses, do they really play an impact on your eyes, or is it safe? Or
no, it depends, the quality of the lens you use and the time you use. Color lens usually I don't promote, but Bahrain, as I told you, many people, like here cosmetically oriented people are a lot. So I cannot tell, no, you don't wear. But I tell them, you use it for occasions.
Okay.
And be very careful when you're using it. Contact lens is a safe thing to use if you know how to use it hygienically.
Oh,
hygiene is very important. If you wash the contact lens with the tap water, you can get severe infections like acanthamoeba, where there is no cure, where you may need even transplant of the cornea.
Oh, it's so serious.
So it can go so serious.
Okay.
It can go so mild to serious. Another thing with the contact lens problem is, people who wear the contact lens, it is same like you wear a shirt, immediately you feel, then you are not feeling. So the people who are wearing contact lens for a long time, what happens to the eye is the sensitivity comes down. When the sensitivity comes down, if there is mild infection, they cannot notice it. So they will ignore the infection until it comes to the stage that
it is worse.
It is worse. So always, if you use hygienically contact lens, it is okay. But never ever sleep with contact lens.
Oh, that's something.
Yeah, some contact lens sellers, or the optical shop may say that no, you can sleep with this lens. This is 100% water going and all. But no, whatever it is, it will not be the same as the normal
lens.
The tearing or the normal moisturization of the eye.
Correct.
And another thing is, when you sleep, all our secretions are less.
Okay.
So the tear secretion also will be less.
Okay.
So it leads to more dryness. Okay. As we say that the lips get dried, cracks, same thing happened to the eye epithelium also. the cornea cracks, which can invite infection.
Wonderful.
So hygienic use of contact lens, of course it is good. The hours should be minimum, and you should allow the eyes to have the normal moisturization. For that, in the house you can wear glasses. If you want to cosmetically look good, you can wear color contact lens. Not against that, but only for occasions for limited time.
So limit the use of contact lenses. Doctor, lifestyle diseases like sugar, maybe blood pressure, does this have an impact on the eyes?
Yes.
For people who are starting to have this? Like, let's say for example, a person is just started or detected as a sugar or a diabetic. So what would be your advice to these people? You know, how to take care of your eyes?
See, you are just detected as a diabetic now, but maybe it was there for years. You don't know.
All right.
See, I have seen many patients who come with decreased vision, and I see a full-fledged diabetic retinopathy in their eyes.
Oh.
And when we asked, they said, no, I don't have sugar. And when we check, it is 340, 360, 400, like this. So diabetes is a disease. Sometimes it will not have any symptoms.
Okay.
So if you detect diabetes, if you are branded as a diabetic, I think you should have a primary eye examination immediately, because you don't know how many years it was there. Usually, eyes are affected in diabetes after 5 years. Usually. But there are people whose eye will get affected even in 1 year, even in very young people, because it depends upon how high your sugar level is.
Very true.
You know, and how it was controlled. So if it was an uncontrolled sugar with comorbidity, we say for everything like that, if you are a smoker, if you have hypertension, if you have cholesterol, if you have some other problem with diabetes, then that can affect more.
All right. So basic mantra is to be safe and practice yourself to such a way that you limit your things and try to reduce it with exercises and.
No, exercise has very high role in diabetes.
Yeah.
The thing which maybe not related to the eye, but it is general. I think the viewers will like it. Insulin deficiency is the reason for diabetes.
Yes.
Okay, so it's not the insulin production is less. Some people the insulin enough in the body, but it is not able to. Diabetes is always told as the starvation in the midst of plenty.
Okay.
That is, you have high sugar in the blood, but the tissues are starving from the sugar. So when you do exercise, local hormones are secreted in the muscle and tissues, which will help to transfer this sugar to the tissues. So even if your insulin produced is less or the produced insulin is ineffective, these local hormones play a lot of role to get the tissues the sugar, or it prevents the tissue from starvation.
Wonderful.
So I always advise that all the diabetic patients should have a brisk walk of 30 minutes, either 5 days a week or 7 days a week.
Okay. Oh, that's wonderful.
If they can do 2 times, it's very good, but at least 1 time.
Doctor, talking about your family now, we've talked enough of professional life and your family. You've created a family of yours.
Yes.
How can you tell us about who all are there in your family?
I got married very late because there are people, when I used to study for MBBS, they used to tell that she want to marry only PG. Like means I want to become a postgraduate. That is my, but that was not the reason. Just I want to go for little family.
Yeah.
We are 4.
Okay.
2 brothers and 1 sister. My sister is a person who is having congenital heart problem, and also she was little like IQ level was not as good as us. So when we were brought up, my father's one of the reason for making me a doctor was that I will take care of her. Thank God now she is in safe position only. I am not telling anything about that. But so I didn't have any concept of marriage. I want to live with my parents, and I thought that I'll adopt 2 girl children and live. There is what I am telling. No, the destiny played a lot in me.
Correct.
So in the age of 30, I got married because my father was pushed by his family members that I should not be kept like this. Okay. Again, I went to a very good family, wonderful family. I have 3 sisters-in-law, my mother-in-law, father-in-law, everybody is very good. And I went to a family where you asked me the joint concept, no?
Yeah.
They live together, like 3 brothers of my husband's live together. So near, and we are farmers basically. So we have land. So it is like a wonderful village life. And talking about my children, I have 1 daughter and 1 son. I just want to tell few things here.
Please.
Because I think very important thing what I want to tell the viewers is, the children, you should not tell them to study when they are young and force them to study to get good marks when they are very young, and if they are not getting marks, it will cause many drawbacks in them. Okay. Any child will start studying by itself when himself or herself when they reach certain age. Okay. So you should give that freedom to that. That doesn't mean that in this competitive world you just leave them. Okay.
Yeah.
Why I'm telling is my daughter was mild dyslexic.
Oh.
So she never used to get very good marks in the schools, and when her younger age, even the teachers used to tell that she is very slow because she don't know everything. She will use her left hand, ulta presentation,
So if it's 13, it will be looked as 31.
Yeah, 31.
Okay.
And everything. So addition and English, she used to hate because B used to look like D, D used to look like B, Q, that alphabets,
Yes.
mirror image, everything had a problem. But I just took it slowly. And then in 4th standard, one of the teachers said, "Oh, she is very good in maths, she will come up." See, that comment gave her a positive attitude to
Was
the
she
life.
with you when the comment was given to the child? Or
No, she never used to come for parent-teacher meeting.
Okay.
Since UKG, because in UKG she had very bad experience. Like the teacher told, she's very, all bad comments. So
Right.
then after that she stopped coming. Until 10th standard, she never used to come for any parent meeting. That was, that is a thing.
Yeah. Doctor, you can just continue, but just let me speak to the people who are listening to us, especially to the teachers. My humble request, it comes from the depth of my heart, is that go ahead and motivate students. You never know. A single word of motivation, just like Dr. Krishnan said, could really change and spring that kind of an action into the child. So please, if you're listening to me right now, please do take this message of us, that go ahead and motivate a child. All that the child needs is a pat on the back and a good word from you and a smile that can spring an action. To all the students that are listening to me, like Dr. Krishnan said, don't be worried about your marks. You will get your marks done. And just like Dr. Krishnan said, set standards and keep growing little by little, and you will reach to the platform that you wish to urge, or you urge to reach to. So make sure that the teachers and the parents and the students work hand in hand to bring about that change. Doctor, you can continue at that moment. I just wanted to share that.
That comment, gave a lot of confidence in her, and she started studying well, and she did very good in 10th standard. She got A+ for everything.
Wow.
Now she's doing her CA.
Okay.
And like that. And another thing is, each child is different. My son is very much introvert. My daughter is very much she's so bubbly. She talks to everyone. So what I feel is, you should go with them, not you make them come to your path. I think that we should come to their level and see things.
Wonderful.
And I always feel that, it is not how many hours you spend with your child is important. When I started working I was pregnant with Sharda, and then I joined duty after 30 days of my cesarean. So that time, many people commented for such low salary or salary base, it was not that great. So now I am well paid. It is different. But why she is working with such a small child and putting baby? But there again, I told you, you have to balance between the profession and the family.
Family, yeah.
You cannot. You studied so much. After struggling so much, you got a degree. Or you wasted a seat of somebody else who could have come up in this.
Correct.
And then you sit in the house, do nothing. I don't think I should accept it.
So you don't subscribe to that view at all?
No. I don't say. I think we should balance between the family and the profession.
Wonderful thought.
Okay, not give importance to everything equally. Then you will be okay. Here, you may need to sacrifice something in the profession. For example, when I joined, one German doctor come to us as a visiting surgeon. He offered that he will take me to Germany for a small, means maybe 3-4 months to train me in retina. Dr. Hassan was willing to send me because Dr. Hassan is always enthusiastic to send for studies. No, he also, when phaco was arrived, I am a surgeon. When we were brought up that time, the phaco surgery was not that popular. And later the phaco became very popular. He told me, you go and take a course in phaco, but I don't want to leave my family and go. My children are small, you know, and I don't want to leave them. So I could have built up a career in that way, but I don't want, my priority was different. So every time the priority changed. You know, one time there was some incident occurred back in India where my in-laws needed me. So I resigned the job and went, but luckily they could come here. So I came back in 2 months. So there was no gap. You know, it was like a holiday, just 2 months annual leave. So things will happen, you know, it will keep happening. You should not go behind things. You know, everything, God is there. He knows what to happen when.
Correct.
So you try to adapt to it rather than going against it.
Wonderful.
You know, always when you go with the flow, you will feel less stressed.
Wonderful.
But if you go against the flow,
you will always be stressed about it. Exactly.
Why you want to stress yourself?
Exactly.
This is a small life. It is not going to be there for a long time. You go with it smoothly. Everything will come to you. You know, nothing, you know, this world is very short and we are going to leave very soon, you know. We don't know when what happens.
So enjoy the flow.
Enjoy the flow and go.
Yeah.
And do the work, what you do. You enjoy the work you do.
Yeah, so
then
the
you
success mantra.
Yeah.
The success mantra I would call is just flow with the flow and enjoy what you're doing.
Yeah. Even, you know, I enjoy the household work.
Oh, that's great.
You know, like cleaning the vessel or, you know, I don't think it as a burden. If I think it as a burden, then surely it will stress me a lot.
Correct.
It's not that I am not stressed. At times I get stressed.
Okay.
If I tell like that, it is a lie.
Yeah, it's human.
Purely.
Yeah,
it's human.
Yeah.
I get frustrated. I get stressed. But, you know, I try to calm down fast and go with the
wonderful. Doctor, now if I would ask
and
you...
I just, you asked about family and I didn't tell about my husband. It will not...
I'm sure he's listening to us and don't worry, Mr. Krishnan.
It will not look nice. He's a wonderful person.
Okay.
And we got married very late. I was 30 and he was 37. Everybody was thinking that two different adults with two different views may not go together. But it's again God's grace. We have many common things. And the trust.
Wow.
Here I want to tell that the trust is the most important thing in a family life, and he is a very good person.
Wonderful.
It's a God's gift.
Wonderful. And I heard that he's a cricket enthusiast also. And, you know, I enjoyed spending some time with him too. Doctor, now, if I even ask you one question, which is very important. What is the future from what you see now? You're almost finishing your professional functions. You may come to a certain point when you'll say, enough of my professional life. After that, what is the future?
See, here, you know, again I told you, it's only my wish. Because the destiny has played a lot in my life. What I want to become or what I am here is different. So that is why I told, even I don't think I deserve this position of sitting here and having an interview with you. But it is God's wish. But if you ask me my wish, you know, back home, I want to go, if I go back and settle in India, I want to do teaching. I don't want to have any commercial practice or any sort of practice, but I don't want to lose this touch with the subject. And I like teaching, I love teaching. So I think what knowledge I have, I should impart to the generation who is coming. That is my first wish. Second, I want to do something like pain and palliative care. I think, you know, that is, I love general medicine. I couldn't do anything in general medicine. So at least in the evenings of my life, I should do something like that. And basically, as I told you, we are farmers. I want to, you know, have a garden with medicinal plants. You know, like there are a lot of medicinal plants or the Ayurvedic things, which is, you know, like degrading or non-existing now
Correct.
because nobody is giving any importance to it.
Correct. So you want to
I
revive
think,
that system.
Yeah,
and-
the system and farming I like also. So I don't know.
So
It's
a
all in
farmer-
God's hand. No, it's all in God's hand. I don't know what it will be because next moment what is happening. We
Yeah,
don't know.
so from
it's
what
my
I-
wish, but it will happen or not, I don't know.
from what I see, Dr. Revathy as a farmer, a teacher, a doctor, a social influencer. Wonderful. I really enjoyed spending such a wonderful time with you, Doctor.
Thank you.
And I really learned and have taken back many things, which I'll surely use in some places where I go and speak. And I will share this wisdom that you've shared. Thank you very much, Dr. Revathy. And if I can shake hands despite pandemic, I promise that I will surely wash my hands. Thank you so much, Doctor.
Thank you.
And really enjoyed this time with you.
Here, I think even one person got some message out of this, I'll be happy.
Wonderful, wonderful.
Thank you.
At this moment, I want to thank Convix, the company that has brought about this concept of Sea Life, bringing out people to the society who have had a different vision and who have impacted the society, just like Dr. Revathy over here. I would like to thank the management of Convix who has come up with this fantastic initiative, Sea Live Spotlight. And I also like to thank the sponsor of this evening, which is Al Arayad Eye Center. Thank you very much for being with us and being such a wonderful audience. Stay safe, stay happy, and stay positive. This pandemic will leave us soon. Thank you and God bless.
See Live.